individuals live in poverty. They're every day trying to get their basic needs met. And if they can't have access to food and healthy food at that, we're not going to have a healthy community.
Helping people put food on the table is just one facet of the hunger issue. Providing healthy foods to feed families is just as important. In recent years, there's been a major shift within the Mid-Ohio Foodbank and its network of partners to provide fresh produce and proteins to their users. It's an effort that is gaining tremendous momentum, and now they're taking it to the next step by actively seeking out people who need these types of healthy foods, people who may not reach out on their own for help. There's a pilot program underway right now in Fairfield County that involves a prescription for healthy foods. We've all heard it many times from doctors and nutritionists. Each of us should eat 5 to 9 servings of fruits and vegetables each day. It's a tall order for most people, but especially tough for those struggling each day to make ends meet.
We take about 60,000 calls a year, and most of those are food calls.
The Fairfield County 211 is a nonprofit organization designed to help connect people in need with agencies that can help. Director Kristen Ankrum says a big part of what they do is solving the hunger crisis.
Our folks who are calling for food are single parents, they're working families, they are trying to make ends meet, they're older adults. They are just your everyday people who are trying to either live paycheck to paycheck or just meet their basic needs.
This past summer, Fairfield County 211 answered the call from the Mid-Ohio Foodbank to test out a new program for healthy food prescriptions. It works just like any other prescription. Doctors at the local community health center identify people who are food insecure, who cannot provide their family or themselves with daily meals.
The doctor will give them a prescription for fresh produce. Because there are so many physical health issues that can be changed with a healthy diet, the doctor will give them this prescription.
The prescription is then filled at one of 2 local pantries involved in the program. Since the program started in July, some 400 food prescriptions have been written and filled by the pantries.
What you typically find is once they've been to the pantry once and experienced it once, they're comfortable going back and getting that set up again.
For Kristen, this program is so much more than just getting the right foods to the people who need it.
This program is important because it starts a conversation that hunger isn't just a charitable concern, it's a public health issue. And if we in our communities can't help folks get access to healthy food, there's a problem. If somebody doesn't know where their next meal is going to come from, or they don't know how they're going to feed their family or when they're going to feed their family, how can we expect them to function?
Keeping our community healthy is a team effort, and that's why many agencies and departments are working in tandem to spread the fresh food message. I'm joined now by Dr. Myshika Williams-Roberts. You know her as the Assistant Health Commissioner and Medical Director of Columbus Public Health. She's also a board member of Mid-Ohio Foodbank. Also here is Charlita Tavares, the CEO of Primary One Health, the city's network of community health centers. Ladies, welcome to you both.
Thank you.
Dr. Roberts, let's start with you. Is it to get fresh foods, especially fresh produce, on the tables of these families?
Oh, it's very important. And for those of you who don't know, we definitely have an epidemic in our community, not only of people who are going hungry, but we also have a lot of chronic health conditions. And leading that is obesity and diabetes. And in order to combat both of those chronic diseases, we really need to offer our residents options, and they need to have those 5 servings of fresh fruits and vegetables a day. When you have fresh fruits and vegetables versus canned or frozen, you're getting more nutrients, you're getting more vitamins, and all of that will help with many of the chronic conditions like diabetes, hypertension, and obesity as well.
Charlita, the city's health centers are on the front lines of helping people in need. How much of that work is all about clients' nutrition and their food needs?
Well, as Dr. Roberts shared, certainly you have to have a nutritious, balanced meal preparations if you're going to be healthy. And if we're looking at diabetes, if we're looking at overweight, having balanced meals is critically important. It also gets to feeding the cells and feeding the brain. If an individual, if a child, an adolescent or adult isn't healthy, they're not going to be ready to learn or ready to earn. So it's critically important that we have the nutritious foods to feed the body so that we can also absorb and metabolize medications if individuals are on medications.
What programs are working right now to make a difference?
Well, certainly the partnership with the Mid-Ohio Foodbank. We have a great partnership with fresh produce being distributed at our West Side location. We've had 7 events over the last few months from August until December 1st, 7 food distribution giveaways, and over 1,700 families have been served. So that's tremendous. That's a partnership that's providing that fresh produce. And then, as one of your earlier guests shared, having those cooking demonstrations so we help people prepare the fresh produce in the most appropriate way or in a delicious way.
Education, I'm guessing, is a big part of that.
Absolutely.
Okay, share with us some of the successes that you have seen with these programs.
Well, we also have demonstrated, had a couple of pilots with the prescription for food for those families who are food insecure. And we've seen a reduction in the A1C levels for those who are diabetic, as well as reduction in weight.
Dr. Roberts, are you seeing more people embrace this push for healthier foods and actually living a lifestyle?
Definitely, we've started to see the trend, whether it's in Primary One Health, whether it's in the free clinic that's offered at our facility, and even in the Columbus City schools, when we see that providers, healthcare providers, health agencies are reinforcing the need to have healthy food options and to have fresh fruits and vegetables, we see an increase in the number of individuals who are participating in that. And then obviously we see that in their health behaviors changing for the better and then reducing some of those chronic diseases that I mentioned earlier.
Thank you both. Thank you, ladies, for everything that you do for our community. Folks, the call for lines are open right now. All you have to do is pick up your phone. Every single dollar donated today will be doubled for the Mid-Ohio Food Bank. Please call right now or go online to donate.